is probably not fixable. We've already shown you this picture. Here's decreased blood flow in a cocaine addict, and we've shown you this picture as well. Here is a heroin addict who died from endocarditis, and what you're looking at is all over the surface of the inside of the heart is bacteria growing, and their heart ruptured. And this is because the bacteria started growing in the blood and it could not be stopped. This is somebody who got anthrax from injecting heroin. It happens very commonly out in California, I believe. I haven't seen any cases here. And here is somebody that is what we call shooting the pocket. When your veins are all gone, and addicts will use veins in their arms, legs, their genitals, and when that finally is gone, what you do is you hold your breath, push down, and the big veins in your neck pop out, and someone just plunges a needle in. And the problem is your lung is about 1 millimeter from there, and you can frequently drop a lung. Okay, so people always dismiss food as a problem. They say, well, you know, no one ever got arrested for, you know, eating. Okay? But people die from eating disorders. People live in shame from eating disorders. And this is a description from step 2 of Overeaters Anonymous. It says, we have driven miles in the dead of night to satisfy a craving for food. We have eaten food that was frozen, burnt, stale, or even dangerously spoiled. We have eaten food off other people's plates, off the floor, off the ground. We have dug food out of the garbage and eaten it. That's addiction. I don't care if it's just food, that's addiction. And eating disorders is a whole separate talk, but basically the most common eating disorder there was, which is binge eating disorder, where you simply start eating and you can't stop, you feel terrible, you're not hungry, but you just have to eat, was just recognized a year ago, okay? That's how up to date with all this we are in addiction medicine. Okay, now, I'm going to turn this over for a reason. Everybody here is sitting like, Jesus Christ. And you're all be given the opportunity to give a summary at the end of the night. And this is one of the ones I got in 2007. And I said, well, I should start sharing more about treatment and more about the benefits of 12-step recovery. And this is what I got a couple of years later, saying I left tonight entirely without anything. So I realize, yeah, I'm good at giving you the bad news, but maybe not so good at giving you the good news. So tonight we're going to have something different. Dr. Brunner is going to talk about the treatment of addiction. And I just want to share one more slide. We've been talking about the disease of addiction. This is our dog. This is my wife, Kathy. She's a nurse practitioner that works out here in Ann Arbor. And this is our dog, Tommy. He's a Bouvier. And we've been talking about the disease of addiction. Tommy himself suffers from the disease of stupidity.